Hello everyone, welcome to InnoHealth Conference 2024. I am Urmila, your host for the InnoHealth Magazine podcast. Today we have Dr. Urmila Bhardwaj. A very warm welcome, ma'am. Can we have a brief introduction of yours?
Thank you very much. I am actually from a very humble background. Started my career in nursing from Diploma in nursing. Though in my school I had been very meritorious, had scholarships throughout my 5th till 12th. And then from there I had worked in Holy Family Hospital. They sponsored me for BSc nursing. I did from AIMS. And then after that I went back to my previous institute which sponsored me, worked there till nursing superintendent, and after that I joined Ministry of Health and Family Welfare, Government of India, did MSc from PGI Chandigarh in community health nursing, and after that I did PhD, and I had worked in Jamia Hamdard from lecturer till professor cum principal for long 25 years. And after my superannuation, I worked in Sharada University as Dean cum principal. The milestones are there, but I was very focused, and I must thank my alma mater, Holy Family Hospital, where I did my diploma, has given me instincts into bedside nursing, how to take care of a client at bedside. Jamia Hamdard has given me lot of opportunity to do research, teaching, academics, how to make the syllabi, how to implement many things, the higher education part of it. And Sharada has taught me how to go with new technology like AI, like doing the patents, writing books. In short period of 2 years I did a lot of these things. And community health nursing I learned from my PGI Chandigarh with my mentors how to, and it has become my breath. community health.
So great to hear that. As you just mentioned that you are from the clinical background as well as from the academic background. So what difference you see that AI is creating in the academic institutions as compared to the clinical?
AI in academic may be very, very helpful because there the knowledge aspect is much. But when we go to the clinical aspect, individual difference is very, very important. I very popularly tell to my students and all platforms that the God has created every individual different. You see, the fingerprint of every individual is different. The even face and everything, when twins are not very similar, the fingerprint is similarly. Every individual is different. So nurses has to see that individual difference and work accordingly. AI will work on a basic level. They will not see the individual difference. And another thing in nursing, the touch, healing touch, makes a lot of a difference, which AI may not be able to do. Because when they have face-to-face interaction, if you say, even a patient is unconscious, you go and touch. The studies has proved that when you have a human touch, they recover faster. So those kind of things are there. It has a lot of impact in education. Clinical also it has, but you cannot get away with only AI in clinical practice. The individual difference, individual attention and individual respect has to be done. Everybody cannot be treated the same way. As God has not make everybody same way.
So as everyone is talking about sustainable environment and sustainable ecosystem, so talking in terms of nursing profession, what are the roles of nurses in creating a sustainable ecosystem?
See, there are so many things. We work 24/7 with the patients. The green environment has to be. A lot of things had been done, had been changed also, but the green environment has to be there because hospitals are one place where a lot of bacteria, a lot of pollution, a lot of things, and it is activity. So many activities goes on. So nurses can participate with other co-professionals like bioengineering professionals and other professionals to see that the environment is kept green. They can have lot of these things, and X-rays, CAT scan, this, that, so many things are going on, and very frequently going on. So she can always use her innovative ideas to reduce that kind of a thing and create a green environment. Sustainability doesn't only come with the green environment and things like that. It is sometimes with the money too. I had done a study on if a child is given a vaccine for tetanus, mother is given a vaccine for tetanus, how will it prevent a child not to have tetanus? And post-test tetanus cost is very, very high. You need incubator, you need hospital. Whereas a 1 rupee or that time it was 1 rupee. That syringe and the tetanus, 1 rupee shot for a mother, 2 shots will save a child from tetanus. So this is sustainability, the preventive. And in community health nurse is mainly about prevention.
So as you were just talking about the community health nursing, so I would like to take up the next question related to that. So what difference you see in the nursing field when it comes to the rural area and the urban sector?
You mean the difference now and earlier?
Yes.
Community health nursing has a lot of expansion. You have a lot of autonomy. You have many things to do to yourself. You are not bounded by many people. Like in hospital setting, there are so many people, and you are not having that autonomy. In community, you have autonomy. You get close. You watch them for a longer period, and it is really, really helping at the grassroots level. It is not necessary that you only have community work in rural areas or marginalized population. It can be for elite as well, because people spend lakhs and crores rupees in the hospitals. That can be prevented with a simple thing. So it is true for everywhere, and it should be sustained. You cannot have so much of money being spent there. Resources are always scarce. So you need to have something preventive, promotive, even not promotive. Preventive comes later. Promotive, primordial prevention. Before the catch-up, a young child in the school, you catch up and tell them the hazards of smoking. So primordial prevention, not yet starting. So community health nurse has a lot of role to play from life till the born.
So it was such an insightful discussion with you, Dr. Urmila. And last but not the least, I would like you to share a short message with our dear listeners.
With which nurses?
Short message for our listeners.
Okay. What you should do is your sincere effort for elevation of people for health. Simple this thing. And take every individual. I always say, I don't know if this is fit here or not, there is a difference between religious and being spiritual. People are religious, it's good, because they go and do some rituals, go to temple, go to church, go to masjid, religious. But I say the nurses need to be spiritual, meaning thereby you see God in everywhere. So every individual is God. See how beautiful it will be. The health setting will be so beautiful when we serve them like we are serving to the God. That is the spirituality. So be spiritual.
Thank you so much for having today's podcast with us. Thank you so much.
Thank you.